Thanks for joining us today for our Mama Talks on preventing and alleviating postpartum anxiety, blues, and depression. So we are here today with Dr. Tara O'Connor, who is a psychiatric nurse practitioner. Tara, do you want to say a quick word about yourself and the work that you do?
Yeah, thank you. And thanks for having me. So I am, as Dr. Lang said, a psychiatric nurse practitioner. Not everybody is familiar what that is. What that means, I have a doctorate degree in nursing, and I am trained in assessment, diagnosis, and treatment of mental health problems. And yeah, many people might be familiar. They have a nurse practitioner maybe at their primary care or as their primary care provider. So a psychiatric nurse practitioner is just a nurse practitioner that specializes in mental health. And I've been practicing since 2008. I have a few different areas of practice, and one of my special interests has always been in perinatal or peripartum, postpartum mental health concerns. It was part of my master's program that I focused on some research and supporting some research that was being done at Mass General Hospital on peripartum anxiety and mood disorders. And I'm also a mom myself. So I've got two little ones. So I got a 3.5-year-old and a 15-month-old. And so it's also now something that I really understand a lot more than when I was studying it as a 24-year-old working on her master's degree. So.
Great. Thank you for taking time to share your expertise on this topic. I would just want to start out first by asking, so there's postpartum anxiety and blues and actual depression. How common are these disorders?
Yeah, they're actually very common. And so I do slides. I might share those and kind of go back and forth and talk about them if that's all right.
Mm-hmm.
Okay. So in terms of statistics, what we know is that somewhere as high as 80% of women experience what we kind of commonly refer to as the baby blues. And in a second, I'll talk about how that differentiates from postpartum depression. There is a reported clinical rate of postpartum depression that is been estimated between 10 and 20% in different studies. So that's really a lot, right? So a lot of estimates look like around 1 in 7. And also I want to kind of give a shout out to fathers and other parents who might also experience postpartum depression or depression during the postpartum period. To adoptive parents with an incident rate of about 8% in one study. And then in terms of anxiety, we know that often overlaps also with postpartum depression, and that more than 60% of women who have postpartum depression also have symptoms of anxiety, and that 13% of women, who are childbearing experience postpartum anxiety. And then there's incidence of postpartum obsessive compulsive disorder around 3 to 5%, and an incident of about 9% of women experiencing postpartum post-traumatic stress disorder.
Wow, that's really common.
Yeah.
Well, given that it's such a common issue, are there ways that pregnant folks can try to prevent these issues from coming up?
Yeah, we can talk about that, and then come back and talk a little bit about how, these conditions kind of differ. I think in terms of, prevention, you want to think about awareness, right? So just knowing that this is a common problem. I think the other thing I want to mention a lot of times when we talk about postpartum depression is that we leave out that kind of peripartum discussion, which is really just occurring during pregnancy and in the postpartum period, and that postpartum depression is, can be thought of occurring anytime in the first year after birth, or postpartum other mental health conditions. So 50% of women who develop postpartum depression begin having symptoms in their pregnancy. So knowing to look out for it, not just in the postpartum, we kind of have done a better job ultimately in healthcare. We still have a lot of room to grow on that, but like we are kind of finally focused in on postpartum depression, now starting to talk a little bit more anxiety, but like knowing that this isn't like kind of proof of peer, like just in the postpartum period, that a lot of times you're going to see those symptoms popping up. The other thing is that, a major risk factor for developing a postpartum mood or anxiety problem is that you've had mood or anxiety problems in the past. So that's very predictive. If you have a family history, if your mom experienced this, or a sister, you're definitely more likely or higher risk. So knowing your risk factors, for a lot of the same reasons that BIPOC individuals experience, other health disparities, they also are at higher risk. And people who are experiencing poverty, people who have had adverse childhood experiences, people who are experiencing intimate partner violence, those are all risk factors for developing a peripartum or postpartum mood or anxiety problem. And then just, touch very briefly on postpartum psychosis. It's actually very rare. It's about 1 to 2 people in 1,000. But a history of bipolar disorder is definitely a risk factor for that. And often is also retrospective, that when somebody experiences a postpartum psychosis, we kind of are at high alert as mental health professionals that this person might actually have a bipolar spectrum disorder. And then the reason why does this happen is kind of a combination of your risk factors, the sleep loss, of course, which is harsh on all of us. If we don't get enough sleep, we will, get sick in one way or another. And then those big hormone fluctuations that happen throughout the course of your pregnancy and also in the postpartum period. And it seems that some people are particularly kind of sensitive to the fluctuations, and for the most part, I think it is the change, the fluctuations. And you might see this like if you experience or somebody experiences premenstrual dysphoric disorder as well. So knowing those risk factors for yourself and kind of how many of them you have, just again, is another kind of way of being aware of what your risk is. If you've struggled with anxiety or depression in the past, then I think it's especially important that you, are aware of your risks, and maybe also just like have a mental health professional as part of your healthcare team during your pregnancy. Or if you know that like there's strong incidence of that in your family. I mentioned doulas here. I mean, doulas have been shown to be great advocates. They're especially having a doula for the health disparities in pregnancy that Black women experience has been found to be particularly helpful. Just having an advocate, improving the birth experience itself, and then having a plan ahead of time. So a plan for how you're going to get sleep, a plan ahead of time for how you're going to balance caretaking and other things that you were taking care of that you now are adding, like taking care of a baby with, or a second baby or a third baby. So having a plan ahead of time of how you're going to do that with your co-caretakers, and then recognizing some of those early signs and symptoms, and also having your supports aware of them and knowing how to recognize them is a significant thing you can do to prevent both the onset of this and also an exacerbation. If you have a history of depression and anxiety and you were being treated for that, and that treatment included medication, it is generally strongly recommended that you continue to take your medication. That is been shown in study after study to be something that is often preventative and helps to decrease the risk of postpartum depression and anxiety problems. And these are just like some other like nice graphics by a Dr. Cassidy that kind of goes over some of those ideas of how you can kind of help support your mental health in the immediate postpartum period, and kind of making a plan ahead of time. Another one that's...
I really like the top right where it says pump milk and have someone do a night feeding for you, because I know that sleep deprivation can be so tough on both depression and bipolar disorder. And I think it's okay to ask for help from a doula or your partner to do a nighttime feeding if it's going to be such a big impact on your mental health.
Yeah, they're getting that restorative sleep, that 4 to 5 hours of uninterrupted sleep. If you can set up a cycle so that you each get a chunk of that, you and your whoever you're co-parenting with or whoever is supporting you during that time, you're both going to be, less likely to have a more difficult time. So it's a big difference. You can really start pumping, like, some people may not advise this, but again, I think you always have to think about what's best for you, your health, and then how that impacts your whole, family unit as well. And so you can really start pumping pretty soon, like 2 weeks. And a lot of people have success with that. And then I like this graphic as well. Again, this is Dr. Cassidy. You can follow her on Instagram. She kind of did exactly what my head wanted to do in terms of putting together some kind of graphic. Just an overlap of different protective factors and things that you might look at that will support you. Holding yourself in the middle of that, all in self-compassion, asking for help, making sure you're getting that sleep at the center. But things like setting boundaries, addressing before you have kids, if you can, right? Or during the pregnancy is a good time to kind of look at your relationship health and do some strengthening work there. How you talk to each other, how you handle conflict, because you're going to be tired and it's going to be stressful, and having a really supportive relationship with somebody who's going to help you to parent this child or caretake for this child really make a huge difference in terms of your mental health. And another thing I think I like this is that identify changes with friends, so reaching out also to other people in your circle, and having somebody you can trust and kind of setting up a plan to check in with them ahead of time. Having a therapist, addressing the body image challenges. A lot of times we're not talking about kind of the physical changes that you're going to experience. I know you do a lot of that on your website, Leah. So so there's a lot you can do, and a lot of it is just kind of the stuff that is good for taking care of ourselves. And it just becomes, more important than ever. So.
Thank you. So how, for someone who's experiencing some symptoms, how can they tell if what they're experiencing is quote unquote normal, or if it's something that's serious enough that they need to seek help from a psychiatric provider such as yourself or a therapist for? And maybe this goes back to kind of your original slide about how to tell the difference between those two.
Totally. Yeah. Yeah. So here, this is a, another graphic that kind of goes over those differences. So with postpartum blues, they're so extremely common. It's kind of more likely that you'll experience some of these symptoms than you will not. And it's just time limited. That's a big piece of it, right? And usually it's going to resolve in 2 weeks. So postpartum or not postpartum, the kind of timeline in which we diagnose a depressive episode is 2 weeks. So if these symptoms have been going on for 2 weeks or more, that is one of the diagnostic features of a depressive episode. And so, what you see, some differences here, it's not just kind of a weepy or emotionality, it's loss of interest, loss of pleasure, feeling intense irritability, guilt, shame, ruminating thoughts, changes in your appetite, not being able to sleep, even when you're given those opportunities, or feeling just like you can't stop sleeping, even though clearly you need to be up more. And a lot of physical symptoms, both with depression and anxiety. So you can't sit still, you're irritable, you might be dizzy or nauseous. The thought process is very overpowering and difficult to control, difficult to shift from. Mm-hmm. And the other thing I'll say about that is, like, when do you know to get help? I always say there's no problem with, there's no like, you came too soon, there's no, your over likelihood of getting overtreated. What we know about depression and anxiety in pregnancy and postpartum, and then also, unfortunately, also just in women and in general, is that these problems tend to be undertreated and not overtreated.
Mm-hmm. Thank you. So if somebody does end up seeking treatment and it's recommended for them to take a medication for anxiety or depression, how safe is that for someone who's lactating?
Mm-hmm. That's a really good question. So the good news is, like, it's kind of very safe, probably, right? So I mean, there's always going to be this caveat, both in pregnancy and with lactation, is that never can say totally for sure, right? And that's always a risk, I think, that people have to carry, but as I mentioned, with taking medications during pregnancy, that we find that, like, overall pretty overwhelming evidence that treating and continuing treatment has many benefits to mother, which mother passes on to baby, rather than some minor risks that may be associated, like a experience of discontinuation of medication when born. The other thing is that depression itself is like associated with lower milk production, and things like SSRIs, which are like the most typical medications prescribed for depression and anxiety, are not, right? So in terms of your milk production, you're gonna be probably better off treating. Not to say that medications are the only treatment, but they are often necessary. So, and then most do cross into the breast milk. There's trace amounts. Most medications, there's a lot of data out there. There are databases, if you are somebody who's taking medication and lactating or pregnant, that you can decide to participate in yourself. And thousands and thousands of women have, and we are able to look at this data and say, like, usually, yeah, the benefits outweigh the risks. Now, there are some medications that's not the case, and you always want to talk to your provider about it. And there are other ways to feed your child, right? And to provide skin-to-skin contact and some of the benefits of that. My mother has a seizure disorder, and so does my sister. And they take a medication for that. And the medication that my mom took was definitely not something that was safe to take when you're breastfeeding. A lot of anti-epileptic medications are not safe in pregnancy. You know, she just didn't breastfeed with my brother, my sister, and I was the youngest. And she decided, well, I, you know, made it through. She went off her meds during pregnancy. I made it through. You know, this is my third, my last. I'll try nursing her. And we got 2 months in, and then my mom had a grand mal seizure and she broke her back. There are no major differences between me and my siblings from that 2 months of, you know, nursing that I received. My sister has the same seizure disorder. She opted not to breastfeed, and that worked well for her because it wasn't really a risk that was worth taking for her to have a seizure. And for a lot of people, it's not going to be a risk worth taking, you know, for them to have an episode of their bipolar disorder. The medication she happens to take for her seizures is a medication that women commonly take for bipolar disorder. So, you know, I just always want to make mention of that. Like, this isn't, you know, can be a lot of pressure and there's a lot of benefits to breastfeeding. And most of the time, of course, the medications are generally going to be safe. And, you know, if it's not, you know, that's something you just got to consider and talk through with your provider. And hopefully you have somebody that's really supportive, because it's not worth having a seizure and it's not worth having an episode of your bipolar illness either.
Mm-hmm. Mm-hmm. So it sounds like depression in itself can cause issues with your milk supply, but SSRIs and probably SNRIs, like, which are things like, you know, fluoxetine or like Zoloft, most of the common antidepressants are actually okay. And it's really the more specialized medications, such as for seizures or for bipolar disorder, that might cause some problems.
Might have some, yeah. Most antipsychotics, though, actually have so far been found to be pretty safe.
Oh, wow.
So there's an option for people as well. And so, and even sometimes short course, when people are having really acute anxiety, they might, in the postpartum period, while they're getting adjusted on SSRI, they might take a benzodiazepine. And overwhelmingly, the data on that is, you know, again, you might need to look out for sedation. These are anxiety medications that have kind of a sedative quality. But most of the data, again, it looks pretty good, pretty safe. And of course, you need to talk to your own personal healthcare provider about these options.
Mm-hmm. So if someone needs to take something for their mental health or another disorder, like, they should, you know, not feel bad about having to do that and take care of themselves, it sounds like.
Absolutely. That's the most important thing.
What about for you personally? Have you found any kind of daily routines or just habits that allow you to incorporate self-care into such a busy time when you just have a baby?
Yeah. You know, I think that self-care looks different for everybody. And I really appreciate you, you know, talking about this. You know, there can be, I've seen sometimes, you know, self-care lauded as like, you know, going to the spa, or, you know, I've also seen people talk about self-care as like, you know, taking a minute to actually pee without the baby in the bathroom with you. And like, those are both like important things, you know, but I think the big thing is creating a healthy space for yourself. And, you know, a lot of that can be setting boundaries, being able to, and that can be a lot of practice for a lot of people, like being able to express what your needs are and ask for what you need, is something that I think that is really a cornerstone of self-care. And then taking time for sleep. Like we talked about those chunks of restorative sleep, having people to help you, and you know, being willing to ask people for help and let them make a decision about whether or not they're able to do that. I think it's really important to have joy, or fun, and making sure that you are setting some time for that. And I think that also some joyful movement. So whatever joyful kind of exercise looks like for you. And of course, as your body is recovering and recuperating, again, gentle with yourself in terms of your readiness to engage and the level at which you can engage with that. And then, of course, staying hydrated and eating foods that you enjoy, that are nutritious, that give you energy. Those things are really important. Taking time for yourself in the ways that you enjoy that, and whether that's, reading and taking, time to do that alone, or taking a walk alone, or whatever it is that you need to kind of refill your cup. It does definitely look different for everybody, but I think those are some kind of foundational things. Being able to ask for help, being able to express your needs, being able to set boundaries, hydrate, nourish, joy, and joyful movement, and taking time for those things. And doesn't have to be long periods of time. You can, other than, wanting to try to get that 4 to 5 hour chunk of sleep if you can, everything else is, things that you can do for, 5 minutes here, 20 minutes there. But if you're not intentional, it might not happen. And so it's really important to be intentional about it.
Mm-hmm. Yeah, thank you so much. Well, I'm so grateful that you came on the show and or the podcast and shared all of this really, really wonderful information. Do you have any last thoughts you want to share with someone who might be pregnant or just had a baby watching this?
Yeah, you're never alone in this experience. There are, billions of people who are going through this experience of being a mom that's so transformative, and there's millions who've struggled with the postpartum blues, depression, and anxiety, and just reach out for help. I put some resources here. So postpartum.net is the Postpartum International support network, and it has information about postpartum depression and anxiety. It has support groups that are online. It has a database to find practitioners who identify as with this as a specialty for them. Another, just postpartumdepression.org is another good website with good information and some resources on there. Womensmentalhealth.org is out of Mass General Hospital in Boston. And it's got lots of, if you're a data junkie, it's got kind of the science is all there, and you can look at it. And there's also a database that you can participate in about your experiences. And then there's the LactMed database, so you can get that information directly yourself if you want to find out about your particular medications that you're taking. There's my information. A colleague of mine who also I know has some direct openings to support women right now who are experiencing anxiety or depression in their pregnancy or postpartum. Dr. Cassidy, thanks for the graphics. They're amazing. And then also I talked briefly about how intimate partner violence is a risk factor. And if that's something you're experiencing, this is the local resource, and it will direct you to kind of specific services for you. And I want to let you know that if you're experiencing intimate partner violence, that advocates that you can speak to on this line will treat your information completely confidential. That means that there's no duty to report to Child Protective Services. They're there to help you get whatever the support you need in that moment around your relationship health. That I think is it. Any other questions?
No, that's really wonderful information. Thank you so much. So Dr. Tara O'Connor, who is a psychiatric nurse practitioner, and you can see her information there on that slide too, and I'll post it on the blog entry as well. Thank you so much for being here.
Yeah, thank you. I really enjoyed it. So.